We are recording this meeting. Everybody should know that.
And Cindy, I believe we are live on Facebook as well. So
Great.
we're good from that side of things.
Thank you, Mr. Weir. We'll give it just a couple minutes here and let people come in, get settled, make sure everybody has their connections. Sherry, it's good to see you here tonight. That's wonderful. Deja. And Michelle and Ron. Give it just a few more seconds. Okay, well, I'm going to go ahead and get started. It's 6:04. So hello, everyone. Welcome to tonight's community update. I'm Cindy Vosberg, Crescent City Del Norte Chamber of Commerce Director. Thank you all for coming. Tonight, we have the city, the county, the school district, and Sutter Coast. And we'll be hearing updates from Sutter Coast Hospital CEO, Mitch Hanna, Public Health Officer, Dr. Stutz, and Del Norte School Superintendent, Jeff Harris. We will also have time for some questions and answers and try to get you all out of here by about 6:45. We are still planning on meeting again next week, and hopefully we won't need any more meetings after that. But if we do, we'll schedule more and we'll be here with you. I want to remind everyone of something that Senator McGuire said last week. He said, we need to fight the virus and not each other. We need to fight the virus and not each other. What he said makes sense. We all know that together we are stronger than alone, and we need to unite in fighting against this terrible monster that is killing our community members, hurting our businesses, and keeping us from living the life the way we want. It is going to take us all. I also want you to know that the Chamber of Commerce is the voice of business in Del Norte County. And on behalf of our local businesses, I'd like to say the following. Along with the healthcare community members who work so hard to keep us healthy and alive, there are hundreds of frontline essential workers. These people service food, they man the checkout stands, they bring the groceries to our vehicles. These are our neighbors, our friends, our family, and each day they go to work and serve us in many ways. Work for them is tough right now. Many of their coworkers are out sick or cannot come into work because they've been exposed to COVID. Think of the team at Walmart. Walmart has 277 team members employed, and last week alone, 150 of them were out. 150 people were out ill. The remaining employees are now doing the work of 2 or even 3 people, and they're trying their very best to keep the service level at what we all expect. So be kind to them. As you go through your check stand or ask them a question, tell them thank you, or what a great job they're doing, or even better, show them some respect by wearing a mask. They are wearing a mask to protect us. We should do the same for them. That's the least we can do, right? And at this time, I'd like to turn the meeting over to Mr. Hanna, CEO of Sutter Coast Hospital. Thank you, Mitch.
Thank you, Cindy. And I must say that figure regarding Walmart is stunning. And I was there yesterday and I had the quickest in and out that I've ever had. So if they're short staffed, it doesn't show in their operations. So
well, they'll love hearing that because they're trying so hard.
Yeah, absolutely. So I just wanted to start by assuring the community that the hospital is keeping our community healthy and safe and treating those patients who are ill. And we are really only transferring out patients who require a higher level of care. And that has been the case through this entire second bout of COVID. We haven't had to transfer patients out because we don't have beds. So that's the good thing. Some people may accuse us of having jumped the gun and setting up a surge tent and prepping. But frankly, that's what you do in healthcare. You never know what's coming. And so you want to make sure that you're prepared. And that's what we have done. And I hope we don't need that tent. It's to date, it has remained empty other than the equipment that is in it. But we did that in order to ensure that we would be available for the community. In addition, I wanted to talk a little bit about staffing. I know some people have been concerned about the vaccine mandate. And I want you to know that I'm concerned about that too. And I will share with you, I was on a call 2 days ago with CEOs and healthcare executives from around the far reaches of Northern California, primarily rural hospitals. But all of us, speaking with our state assemblyman and senator, expressed our concerns about the implications of the state mandated vaccine mandate, which goes into effect September 30th. While it I'm sure was well-intentioned, we all acknowledge that we have a lot of staff, particularly in rural communities, that have not been vaccinated. And frankly, if they hadn't started the vaccine by today, assuming that it's a 28-day gap between first and second dose, and if they're getting a 2-dose vaccine, they won't be able to work for us come September 30th. So we are very concerned as to whether we will have adequate staff. We are working closely with our managers to try to encourage staff to get the vaccine. There are waivers for staff who have either medical reasons to not take the vaccine or religious reasons, and we are certainly fielding those and open to reviewing those. But I do want the community to know that this is not something that Sutter imposed on our workforce. This is something that the state has imposed on employees throughout all hospitals, as well as psychiatric hospitals, as well as skilled nursing facilities. So we are really working diligently to ensure that we don't have lapse in coverage because of that. With that, I just wanted to talk to you a little bit about what we have been experiencing over the course of the last month, and then I will focus a little bit on current data. But Eric, if you could put up that first slide for me. So this is showing you the month of August, and you can see early on we started to see a little bit of a pickup in COVID cases, which we had really not seen. There had been a month or two where we had very few COVID cases, and the orange line is depicting the COVID-19 positive inpatients, and that blue bar is the total inpatient population. So you can see there were days there where the vast majority of our patients were COVID positive. And while we've always had beds for all of our patients, we did have to reconfigure our units. So for instance, our acute rehab unit has had to accommodate medical surgical patients. And we've made room in other areas to accommodate that inpatient population. You could move on to the next slide, please. So this is the, again, the month of August, and showing you hospitalizations. Of those hospitalizations, and the difference in color here, and for those of you who are not, who are calling in or don't have access to the visualizations, I'll try to describe it. The orange bodies represent unvaccinated patients. The white bodies represent vaccinated patients. So you can see that the vast majority of our hospitalizations in this month of August were unvaccinated patients, and I'm talking about COVID patients. So 87% were unvaccinated. Of those that are outlined in black, those are patients over 65. So you can see that, again, the majority of the patients who have been afflicted with COVID-19 have been a little bit younger population, which is a difference from what we saw in the first go round with COVID. The second visualization there is showing you those who are critical care, and the third is those who were on ventilators. And again, it's kind of stunning to me when I looked at this in a month and point of time. We look at this on a daily basis, but looking at the entire month to see how few vaccinated patients were on vents and how few vaccinated patients required critical care. So while vaccinated patients have indeed needed to be hospitalized at a much lower percentage than non-vaccinated patients and requiring much less critical care.
So Mitch, just real quick. So what you're saying here is that of the folks that were on the ventilators, that one of them was a vaccinated person and all the rest had been unvaccinated.
That's correct. And that one vaccinated patient was somebody over 65. And I haven't gone into the comorbidities here, whether that person, had obesity or diabetes or some of the comorbidities that we have found are common obstacles in the treatment of COVID.
Right. Thank you.
The next slide is just a point in time, and this is September 1st, so yesterday. And you can see that we had 20 patients in the hospital who had COVID positive, and of those, 2 were vaccinated, so basically 10%, and 90% were unvaccinated. And again, critical care, we had 1 patient who had been vaccinated who required critical care, and 1 who required ventilator assistance. And I'm mentioning this, I think for the obvious reason. These are the figures, but when people say, well, why should I get the vaccine? Because people who have the vaccine are getting COVID again too. They are, but the difference is the criticality of their condition. So don't be deceived by that. And the next slide, this is deaths, not a slide that we really like to think about too much, but this is the harsh reality. We have had 11 patients die from COVID at Sutter Coast Hospital. That's not to say we haven't had a couple transferred out who have died subsequently, but the vast majority have stayed in our community and in our hospital, and all of them have been unvaccinated.
Wow.
And again, the black outline represents those who are over the age of 65.
So what it's showing here is not only is it the unvaccinated, but that this Delta is really going after the younger people as well.
Yes. Okay, and the last slide I've got there, this is I wanted to just kind of share with you some statistics in August, and this is just looking at our drive-through clinic, testing clinic, and the vaccination sites at the community clinic behind the hospital. We administered 610 vaccinations, which doesn't sound like a lot, but for a small community and in one site, that's really good progress. We tested 2,245 people for COVID, and we administered 198 monoclonal antibody treatments. And then below, I've just put up, and I'll read it for the benefit of those of you who might not have access to a screen right now. We continue to have a vaccine clinic where you can go in and get a free vaccination Monday through Saturday, 9 a.m. to 6 p.m. And it's in the building 780 East Washington Boulevard, which is the kind of salmon colored building behind the hospital. You can walk in, no appointments are necessary. And honestly, I don't think that there would be a long wait, so don't let that discourage you. There's also drive-through testing at that same building, and you'll see where there are cones there designating the drive-through area. And again, I think the most I've seen is maybe 3 cars in line, and it's a fairly quick process for the drive-through testing. No appointment is needed there as well. And then the monoclonal antibody treatment is also Monday through Saturday, 8 a.m. to 6 p.m. That is by appointment, so you do need to call that number. It's 707-464-8954 to make an appointment. Same location, so all 3 are at the same location there. And the monoclonal antibody treatment is really for people, and I'll defer to Dr. Stutz. He's going to be speaking right after me to give more specifics, but for people who may currently have COVID, and it's a means of treating it with antibody therapy. So with that, I will turn it over to Dr. Aaron Stutz.
Thank you, Mitch.
Thanks, Mitch. So I'm going to go through some of the countywide data, but first I just wanted to comment with regards to the introduction about Walmart and some of the other local stores in town. I've had some feedback from the community, especially from pharmacies in the area, that there are patients who are known COVID positive patients who are still going to pharmacies to fill their prescriptions and things like that, engaging in normal shopping behavior, things like that. And this is just my plea to the community that if you are COVID positive, if you're a known COVID positive, or if you're on quarantine and you're a suspected, exposure, you cannot be going outside your house into the community to do your shopping. You cannot go to the pharmacy to pick up your prescriptions. You have to please make other arrangements. Walmart, and I'm sure many of the other pharmacies in the area have curbside pickup available if you absolutely need to go pick it up yourself, or if you can't arrange a friend or a loved one to go pick up your prescriptions or your shopping for you. Many of the pharmacies will also ship to your home. You can have your prescription shipped to your house. So please, if you're COVID positive, or if you're in isolation, or if you're in quarantine and you're waiting for your test results, don't leave your house and go out and engage in your normal behavior. It's not acceptable in this environment. Please do not do that. So I'll continue with some of the data, countywide data that we've had over the last couple of weeks. I don't have a nice PowerPoint to show like Mitch, so I'll just read it. But our testing positivity rate for the week of August 20th through August 26th is about 14.98, or about 15%. And anyone who's been following the testing positivity in the community would know that that's a pretty high number. 1 second.
Aaron's a new dad, so
we all love babies, right?
And that testing positivity rate is up from the prior week of 813 to 819. I'm sorry, that's about equivalent. So the prior week was about 15.2%. So not much change there. But again, if you've been following the numbers, you know that 15% is an enormous positivity rate. That means, for every 100 people that come in and get their COVID tests, whether they're symptomatic or not, 15 of those people are turning up positive. That's huge. I'll move on to the hospitalization and admissions for the county. The 7-day average for the week of August 20th through the 26th was about 2.1 patients per day. So over a 24-hour period, we were averaging an admission of 2.1 patients. The prior week, it was about 1.4. So that's definitely up by 50%. So hospitalizations are still going up, and even though our cases might be leveling off, as everyone probably already knows by now, the hospitalizations do lag by about 2 weeks behind the case numbers. So I do expect our hospitalizations to continue going up over the next couple of weeks, even if the total number of cases levels off. ICU patients wise, our 7-day average for the week of August 20th through the 26th is about 7.3 patients on average in the ICU, as compared to the prior week of about 5.8 patients. So that's up. And then the statistic of deaths secondary to COVID in our community is also up. So the week of August 20th through the 26th, we had 7 COVID-related deaths, whereas the week prior we had 5. So that's up by 40%. Our vaccination rates in the county are slowly going up. Fully vaccinated for that same week, we're at 43.6% of our population vaccinated. The prior week was 42%. And then partially vaccinated is also up at 8.9%. And the prior week was 7.8. So the age range, I'll go back to the deaths really quickly. The age range of the 7 deaths that we've had since the 23rd of August ranges from 50 years old to 70 years old. And then I didn't mention this last week, but the age range of the 3 deaths that we had had from August 16th through the 22nd was 30 years old to 64 years old. So we actually had a 30-year-old person who succumbed to COVID during that prior week. So this is definitely unusual, seeing many younger patients. And I thought that Mitch's infographic was very striking insofar as there were actually more COVID deaths that were under the age of 65 than over. And to me, that speaks to how effective the vaccine is, because the percentage of our population over 65 that's fully vaccinated is somewhere between 60 and 70%. So those people are protected by the vaccine. And that's all I have to say about that. Let's see, the next topic, I think I'd like to briefly speak about, just reinforce the mask mandate and capacity limits recommendations that we put out last week. It's hard for me to tell from my feedback from the field, if this is something that's really making an impact with people's behavior, but want to reinforce the importance of masking when you leave the house, even outdoors in large group settings where you can't stay away from people, where you can't socially distance, as well as voluntarily canceling your large group activities if you please can. If there's absolutely no reason to have your birthday party or large gathering, then just please don't do it at this time. Wait until there's a safer time to do it, when our hospitals aren't getting overloaded with COVID patients. There was some new sports guidance that came out for the state just yesterday, I believe. And schools and school sports are really high on everybody's list of concerns. So we do have some guidance. Many other counties have mandated masks during school sports specifically. Our mask mandate covers school sports that are indoors, or people can't, or where students can't socially distance. So technically they still should be wearing masks when they can't socially distance from one another during sports, even though we haven't specifically required them. And otherwise masks are required by CDPH in schools anyway. So that issue is pretty much settled. As insofar as is it advisable to keep our schools open during this time? Is it something we should be doing? I absolutely feel strongly that we should be trying our hardest to keep schools open and keep kids in schools, even during this risky environment. It's something that we have to at least try to do, even though there's been a lot of outbreaks and things at schools around the state and in neighboring counties, and many schools have shut down. Most schools have pretty concrete protocols in place for testing, and some of them are able to carry out those protocols. Some of them have the resources to do that. Some of them don't. And so we're falling back on simple, closure of schools in some districts and things. I expect that to happen. I expect it to be really rocky. But I still think it's a worthwhile endeavor. We really have to keep kids in schools, even during this COVID environment, because the impacts down the road in the future, as well as now, for parents and being able to go to work and have someplace safe for their kids to go, and it's just too much of an impact for our society to not try and keep them open. So when people ask me, do I think it's smart or wise to keep kids in schools, to keep schools open during this time, I absolutely think that we absolutely have to try and to keep them open, no matter how bad this gets. And so I think more about that later on with another panelist. Let's see. I want to reiterate that if you're looking for more information about testing or vaccination sites, you can go to the county website. We have most of those locations listed on there. Follow up with your primary care clinic or your primary care provider. Please try to use the hospital, and not just for testing, but if you're actually sick. It's very difficult for the hospital, the ER especially, to keep up with patients coming in for testing. You're supposed to be sick when you go to the emergency department, so that we can see you for an emergency issue. If you're really in need of medical care, you're worried, obviously you need to go to the ER. But if you're just in it for a test, please just wait and go to a clinic during normal business hours, or go to the clinic behind the hospital. That's what those things are for. Okay, that's what those settings are for. Plus, if you end up at the ER, you're going to wait a long time in this environment to get your test. A long time. That's about all I have for you guys today.
Thank you, Dr. Stutz. So Jeff, can we hear from the school district, please?
Yes, ma'am.
Superintendent Harris, thank you.
So, you know, I think to kind of put in perspective what Dr. Stutz was just talking about the kind of the impact that the last year and a half has had on our students. We were walking, I've been through every school so far this week, some more than once. And one of the things that I think struck me out of the blue, and I think we all know it, but it didn't really strike me the way that it did until I had this conversation, was that if you think about a second grade student, these are children who should already have had their basic ABCs, colors, shapes, letter sounds, all those different pieces. These are students who should have been in the basics of writing. For some of our second grade students, the last full school experience they had was one semester of kindergarten, and now they're in second grade. They've missed out on academics, developmental milestones, social emotional supports, and we're expecting them within the next 12 months to do what every second grader does. We're catching up on 2 years of all of these things, and keeping them on grade level for second grade and getting ready for third. And if you think about our high school youth, we've got some high school students now in 10th grade. Their last experience was first semester of 8th grade. They've never been a high schooler. They don't know what it is, and yet they're 3 years away from stepping out into the world. So we have a huge job ahead of us, and I agree with Dr. Stutz. Whatever we can do to keep kids in school, but to keep them safe, is going to be a critically paramount job for us over these next 10 months. So I do want to share a few things with you. Our enrollment is pretty stable. We have a lot of students. We've got students that we weren't expecting that are enrolling in our schools, which is a good sign. We've got a lot of families that have reached out, and they're very supportive of having our students back. But of course, we all know that anxiety is high as well. But I just want to tell you all, our staff is doing a phenomenal job. And as we were walking through schools, our students are doing a great job. So just an update on some of our safety factors so that you know what we're doing. And this is not everything we're doing, but this is representative. So like Dr. Stutz was saying, masks are required for everyone indoors unless they're working alone in their offices. So you should never see staff at a school site without a mask on. Masks are required outdoors for everyone if they're unable to physically distance. And I have to tell you, we've noticed as we've gone through classrooms, and again, we've been through almost every classroom in the district over the past 4 days. Our students are doing a great job of masking appropriately. And if they're not, it only takes a simple reminder and the masks are back up. The kids are doing well. So I just want families to know that. We have continued to provide hand sanitizer. Schools are staggering lunches to minimize the number of students in the cafeteria to maximize distancing. And they're also disinfecting between groups of students as they come in, or they're even eating outside to kind of get that airflow and to get kids out of those more limited spaces. We've limited non-essential visitors from campus. We're asking people, again, like Dr. Stutz was saying, please stay home if you are COVID positive or symptomatic. We've had people show up on our campus to pick up a child who was a positive case, and we've had to say, please leave the building, we'll bring a child out. And parents, we've had this other issue too, and that is we've had families who think their child may have COVID or they're symptomatic, so they get them tested. That's wonderful. But what they've done is they've brought them to school until the test comes back. If you're having your child tested, please keep them at home until that test comes back, because what that has actually led to is the situation that we're in today. As of today, the report that I received, we have several positive COVID cases of students within the schools. We've also had several cases of staff members. Now, my understanding right now is that there has been no reported spread within the schools. It's been caught early. Given the timeline, we believe that most of these cases were brought or were contacts of other positive cases over the weekend or last week. But the result is, and this number is going to sound pretty astonishing. And again, remember, we only have 3 to 4 positive COVID students. But what this has meant is we're having to quarantine almost 300 students out of our district until the end of next week. So almost 1/10 of our students will be going home until the quarantine is over. So what are the protocols? Because this is what I get asked all the time. What about the positive student? What about the close contact? If we have a positive student or staff member, they have to isolate per public health directive. And again, if you're positive, please stay home. Don't be out in the community. For close contacts, this gets a little bit tricky. So if we have a vaccinated staff member or a student and they're asymptomatic, they can continue to attend school without testing, but they have to verify their vaccination status. Now, we're not going to take a copy of that. We're not going to put it in their file, but what we are going to ask them is to see a COVID-19 vaccination record that's been issued by the Department of Health and Human Services, Centers for Disease Control. We're going to ask for an alternate, which could be a photo of the vaccination card, a photo of the vaccination card on their phone or electronic device, or documentation of the vaccination from a healthcare provider. So we need to see those things. And again, if they're a close contact and vaccinated, they get to continue at school. However, unvaccinated staff and students are required to quarantine. Currently, we're looking at hiring, we're trying actively to hire additional nursing staff and health aides to assist in testing. And once we're able to hire those folks, we'll be able to train staff in the testing protocols, and then we'll be able to offer something called a modified quarantine. In a modified quarantine, that means that unvaccinated close contacts who were appropriately masked at the time of the contact, and again, this goes back to what Dr. Stutz was saying, masking is required indoors at all times. They may continue to attend school, but they're eligible to remain only if they agree to test 2 times per week during what would have been the quarantine timeline. So to be tested, a parent or guardian has to provide permission in advance for that testing to occur. Now, I know this is controversial, I've heard it, and that is information that went out that a parent may not want their child tested, a child 13 years old or older can actually give permission for themselves to be tested. So I want to be really clear. The California Department of Public Health, beginning in January, in their guidance, made it clear that based on California Family Code 6926, that any child age 13 or older could consent to medical care related to the diagnosis or treatment of a disease. And according to the health and safety and civil codes, the school, which is considered the provider for the test in this instance, is not permitted to inform the parent or the legal guardian without the minor's consent. So that rankles folks. I know that rankles people, but that is in family code, health code, and civil code. So just know that that's there. Unvaccinated staff and students who are not masked at the time of the contact will not be eligible for the modified quarantine. They're just going to have to be out. If folks are required to quarantine, each student is eligible for independent study so that they can continue grade level work. However, this independent study is a little bit different than what we had in the past, because due to the quarantine timelines, you don't have to get prior permission for that independent study to start. And that independent study can be anywhere between 3 days and 14 days. So as soon as you're quarantined, feel free to let the school know that your child's been quarantined. We will probably already know through our contact tracing. And we can provide you with independent study for your child during the time that they're out. And within 30 days of the start of that independent study, we'll have you sign the contract. So there's no extreme rush to sign those contracts. Again, we don't want symptomatic community members. We don't want symptomatic family members or close contact family members coming into the offices. We'd rather get you that work, let your child take it home, and worry about the paperwork later. Now that's short-term independent study. Again, I started this off by saying I know that there is some anxiety out there. And if you are interested in long-term independent study, I'd ask you to visit our website. It's dnusd.org. And you can click on the interest form in the header to sign up and say, yes, I'd like the long-term independent study, or you can go to dnusd.org/is. And there's a lot of information there if you click on the blue link, so you get a really good background and understanding of what independent study is. Or you can click the red link and you can just fill out the interest form, and that starts the process that you need to enroll your child in independent study. And just very quickly, I'm just going to go back to what Dr. Stutz said again. I should have just let you talk for me, Dr. Stutz. I could have just interjected and we'd have been done. New guidance did come out yesterday afternoon regarding athletics. What we currently have is that mask guidance. Masks must be worn inside, and for large outdoor events, masks must be worn if you can't physically distance. I have to say, the other day we did ask our community to wear masks at the first football game of the season. I know everyone was really excited, but out of everybody we saw in the stands, there were probably not more than a couple of dozen masks that were being worn. People were mixing, people were at the snack bar. And I know our community cares about our kids. I know our community cares about our staff. And we just want to ask you, if we continue to have positive cases, if spectators are choosing not to mask, like Dr. Stutz had said, we may be required to limit attendance at games either by CIF, the league, or by public health. We don't want that. So we want you there. We want you to support our youth. We want you to support our staff. And there are just a couple of rules. And the number one is mask up. So just very quickly, for more information on kind of all things COVID that we have going on in the district right now, you can actually go to our website, which is dnusd.org/family resources. And that will actually take you to our COVID page that looks something like, let me see here. I'm just going to share the screen. It looks like that. And on this page, again, as I said at our meeting last week, we are trying to be extremely transparent. Up at the top, these are all links to the documents that we are required by law to enforce. This COVID dashboard is updated every Tuesday. It does take a few days to gather the information from public health to get it all coordinated and input into the dashboard. But when you click the dashboard will open. It will tell you the number of students across the district by school site who have tested positive, the number of staff by school site who have tested positive, and the percentage that represents at the school site and within the district. And again, we update these every Tuesday, and we try to be as accurate as we can, but we all know right now numbers are changing quickly. So just know that this is there as well.
So Superintendent Harris, a couple of the questions that we've gotten in is where can someone see the COVID numbers for staff and students for Castle Rock and Uncharted Shores?
So the COVID numbers for the district are where I showed you, Cindy. Castle Rock, we're currently working with them to develop the same sort of site. We didn't develop that site last year because that was really to track the students who were in person on campus. And Castle Rock is an independent study school, which means their students aren't required to attend campus in person. We are working with them to get the same sort of chart up. Uncharted Shores is actually an independent charter school, which is not run by the district, and we don't have access to their numbers. We don't know how many students or staff are positive.
So then somebody would need to contact them directly.
Absolutely.
Okay, all right, great. Okay, so Superintendent Harris, did you have anything else to add before we get into kind of a rapid fire question and answers?
No, ma'am, I think I'm good.
Okay, so we have quite a few questions that we want to get through, and we want to be respectful of everybody's time. So I'm going to ask our panelists to try to keep your answers brief, but accurate and complete, so that we can get through some of these. So I'm going to start off with Mr. Hanna. How does someone know when they should go to the emergency room? How do they know when they're ill enough?
Well, I think Dr. Stutz mentioned it. When you are, I don't think that there's a, hard and fast line there, but I think when you feel so sick that you don't feel like it would be prudent to wait until the next day or to schedule an appointment with your primary care physician, by all means, we've got several options for you. We've got our walk-in clinics, both in Brookings and across the street from the hospital in the rural health clinic. And if you feel like you need emergent care with a physician as opposed to a PA, which is who would presumably be seeing you in the walk-in clinic, go to the emergency department. Dr. Stutz alluded to the fact that there may be a wait. Certainly, we triage patients, so based upon how critical the patient is, they get seen on a priority basis. But we don't want people avoiding the ER because they think they're going to contract COVID if they walk in the hospital. Actually, during the first round of COVID, there were a lot of serious illnesses that went untreated, and as a result, people either got sicker or had a fatal outcome. So if you really feel that sick, go to the ER. I can't really tell you certain symptoms, but it's going to depend on the person and how they're feeling.
Okay, great. So Mr. Hanna, I'm going to stay with you since we're with you right now. So are we recording the number of COVID cases being flown out of Sutter Coast, and how do we go about finding what that information is? And a second question to that came through tonight, which was the numbers that you shared with us earlier, were those including any COVID cases that may have been flown out?
No, I think I mentioned that. Any of the deaths would not reflect patients who may have been transferred out and died elsewhere. We have not transferred all that many COVID positive patients. We don't specifically track that. We certainly could. We can pull that data. We track transfers in general. We don't track it by diagnoses, but it's certainly data that we could pull. But again, it's not a significant number of COVID positive patients that have been transferred out. And those who have typically been transferred because they required a level of critical care that we could not offer.
Mm-hmm. Great, thank you. And Dr. Stutz, why would someone be quarantined for 14 days for exposure to COVID-19 versus someone who is tested positive with COVID and are only quarantined for 10 days from start of their symptoms?
So yeah, those rules were a little bit confusing. They recently sort of simplified those. For the most part, people can just quarantine or isolate for 10 days now. But the reason why there was that 14-day quarantine period for people who are exposed is because it's an easy answer is because we needed some days to get the test back to find out if you're positive or for you to declare symptoms. So if you add the average number of days between exposure and then coming down with COVID symptoms was somewhere between 3 and 5 days. that's 4. If you add 4 to 10, you got 14, and that's why we were saying that's why we were saying 14 if you were exposed, because it does take a few days for us it takes a few days for the virus to declare itself. But if you already have symptoms or you have a positive test, it's 10 days. But really, it's 10 days for everybody now, because I think that recently changed this week. So for the most part, if you're in doubt, it's 10 days.
Okay, great. Thank you. And we're going to stay with you for a moment. And so, oh, sorry, Mike. Okay, so when will the booster shots be available? And this is actually like a 3-part question. So when will the booster shots be available? When will it be available for senior citizens or anybody? And do they need to stay with the same brand of shot as they originally received?
Yeah, so it's kind of unclear. It's kind of unclear when they're going to be generally available for other people. Right now, the recommendation is only for immunocompromised people, and you could consider senior citizens sort of immunocompromised and much more likely to have a bad outcome from COVID or anything else. So depending on what physician you're talking to, they may want to give you a booster shot as a senior citizen. However, there is a list of sort of qualifying immunocompromised states that most people are abiding by. It sounds like especially from discussions today, there was a CDPH discussion between health officers about booster shots for the general population. It sounds like the federal government is going to really encourage this in this month. However, it's not clear to most health officers and the health departments in the state of California how that booster shot is going to be delivered. There isn't the supply of vaccine at the moment, especially through public health or a lot of primary care clinics to even provide booster shots to everybody who may want one or who at least got one originally. So that's going to be a real issue, is how to actually get that booster shot to people who want it. There's going to be a supply issue there, is what we're fearing. And then what was the next part of the question?
I think it was whether to stick to the same brand.
Oh, thank you. Yeah. So yeah, the recommendation is to stick with the same brand. I have heard some colleagues advocate for getting the other brand, just to sort of boost your, the antigens that you're exposed to. It's really unclear what the best course of action is right now. At the moment, they're only recommending the same brand.
Thank you very much. So this question is actually for our city manager, Mr. Weir. So it seems that one of our past county supervisors has stated that the truck at Weir's Mortuary is empty. Is that true?
Well, Cindy, I think we all wish that were the case. And when the truck was coordinated through the County Office of Emergency Services, we were hoping that we would never have to use it. I know I talked with Joseph Sidorsky, the current owner of Weir's. We talk on a daily basis. They're still beyond capacity. The numbers that we saw with the death rate, that then goes to our mortuary, and it's really overwhelmed our resources. So unfortunately, no, that truck is needed. That truck is running, and that truck is currently in use. Talking to Mr. Sidorsky, he agrees. He would love for that truck not to be there and not to be in our parking lot. These are our our loved ones, our friends, right, our neighbors. But unfortunately, we need that as a community right now. We'll say one other thing that Mr. Sidorsky asked me to pass on from him, and that is just please, for everyone, consider getting vaccinated. We've all seen these numbers tonight, and especially when it comes to the deaths. 100% of those deaths, that the statistics that we saw were unvaccinated people. So unfortunately, that's the answer to your question.
Thank you, Mr. Weir. Thank you. So this question is for Superintendent Harris, and it looks like it also could be for Dr. Stutz. It says, how about indoor music programs, singing and band, etc.?
So I'll just say, I think what we're going to be looking at is a situation similar to what we were looking at last year, where we are probably going to have to revert back to music and choir being done outdoors. Or we're going to have to look at modified face masks. There are some face coverings that are made to be able to play instruments. But then we're also going to have to buy bell covers for wind instruments if we're going to have it done indoors. And then we may also have to look at physical distancing in those music and music classrooms.
Thank you. Okay, great. Dr. Stetz, I have a question for you that we have a few people asking. And so and excuse me if I stutter on some of this stuff. Some of it's not some typos and stuff as people put this in, but the question is, it seems we should be closing restaurants and hotels due to this outbreak. I'm concerned that after Labor Day, we're going to see another huge increase. Please help protect Del Norte County. And a second part to that was a second person said, I would like to know why we closed down for lower numbers, but are not now with our numbers as high as they are.
So yeah, those are all very good questions, and that stuff is all certainly on the table. The easiest one to answer right away is why, when we have higher numbers now, why we're not closing down. Well, that's so easy. I mean, we have all the systems in place that we put in place last year to deal with the surge in cases that we're getting now. So last year, we were all new to this. We had no idea what to expect. And the knee-jerk reaction was to close things down to prevent people from interacting with one another and transmitting the virus and then having to deal with the fallout. Well, now we have a huge army of CDPH people and public health people and a lot of huge bodies of knowledge to deal with this. And so we have much better systems in place to deal with the surge of patients. Last year, if we'd had these patient numbers, it would have been a lot harder to deal with. Well, now we feel like we can do something about these numbers and perhaps not have to close down restaurants and bars and things like that. It may come to that again. That's always something that's on the table, but that's like a last ditch effort, to tell the community that they have to isolate at home again. I mean, that's something that nobody wants to do. So and we have these systems in place now. We built them over the last year and a half of working with this pandemic, and now let's use them so that we don't have to do those things anymore.
So a follow-up question to that, which is along those lines, but deals more with the offices. This person writes that our office is reducing capacity by 50%. Is that enough? We all mask, but still have a few people who are unvaccinated. So I would like to answer, just throw in here real quick before you answer that. The Crescent City Del Norte Chamber of Commerce has just received another 11,000 N95 masks. These were provided by the state health department to push out to area businesses who have unvaccinated employees that are in the office. And so you can actually get free masks, up to 20 for every one of your unvaccinated employees, and have them wear the N95s in the office, and which are much more safer than even the surgical masks. So you can reach out to me at the chamber office right there on Front Street. Look up the phone number in the phone book or Google it, but we're happy. We also have some masks that the city still has some left over that we will be passing out for area businesses as well, for their other employees. So please, business owners, reach out to us and let us help you with some of those supplies. And then Dr. Stetz, is 50% enough, reducing capacity by 50% enough? Was the question, and the mask.
Yeah, so it's hard to say. That was a number we just, threw out there because it was enough to make an impact. It's easy to calculate. You look around the room, you can immediately tell what half of your capacity is, and it might make an impact. There's no way to really know, and also it depends on what your metric is. What is our endpoint here? Is our endpoint to keep as few people from getting COVID as possible, or is it to keep our hospitals from getting overrun? I think everybody understands that in this environment with the low vaccination rates that we have, and the fact that we're not closing down the economy, that we're still going to have people getting COVID. We're still going to have people going to the hospital from COVID and dying of COVID, as we do with other infectious diseases. And so we have to work our way through this system until we get to a point where we can get back to as normal a place as we were at can still have the economy open, right? And so
Right.
it's a process of trial and error. Is it enough to prevent people from going to the hospital? Every little bit helps. So yes, it is enough to prevent more people from getting COVID. Is it enough to stop it? No, people are going to keep getting COVID and dying and going to the hospital. I would be happy personally if the hospital was not being overrun with COVID patients. That's my personal objective. In addition to keeping people from getting COVID and dying of COVID, I really want the hospital to stop getting overrun.
Right, right. So we're going to do, it's approaching 7 o'clock. We're going to do a couple more questions that have come through. And then I just want to remind everybody that we capture your questions that aren't answered, and we group them together, and we have another session already scheduled for next Thursday at 6 o'clock. We'll be here. We hope that you'll be here. We hope that at that time our numbers are looking better and that we've leveled out. And that our deaths, have started to diminish, because that's the real kicker, right? So, so I have a question for Superintendent Harris. So how many students, oh no, that's one you've already answered, I'm sorry. So this one is who determines what is a safe class size for the various grades of school?
So there really is no class size, Cindy. Basically, CDPH has basically said that with masking, hand washing, cleaning, and other mitigation strategies, that no distancing is required. What we are trying to do is we are trying to keep sizes manageable. Now, I will tell you, one struggle we've had is some of our schools, we saw more students enrolled than we anticipated. In other schools, we've seen less. And so what we are currently doing is we're working with our principals and with all of our sites to go through and to balance classes to the best of our ability. And again, encourage that maximizing of distance, but really, really, really focusing on the masking, hand washing, cleaning, disinfecting, and other strategies to keep students and staff safe.
Great, thank you. So Mr. Hanna, so let's see. When and what determines if someone can receive the monoclonal antibody treatment, and can someone request it and have Cedricos provided?
So the best thing is to go in and be assessed. And I gave a phone number there. I can give it again to call to get an appointment. I mentioned earlier somebody who is testing positive for COVID would qualify, but it also is possible to use as a prophylactics measure for people who may have been exposed, had close contact to somebody who is COVID positive. And typically they'll do an assessment, and there needs to be one or more additional risk factors, and one of those being a body mass index of 25 or older or over. And I asked my staff, well, 25 or over, how significant is that? They assured me that I would qualify. That'll be noted on their evaluations. But I just think that it's best to go into a provider, have them make that assessment with you if you have any concerns that you've been exposed or that you're perhaps exhibiting symptoms, and they can work with you on that.
Great, thank you. So I would like to at this time thank everyone for their time, both the panelists and our community who came out and joined us. We want everyone to stay safe, be kind to each other, and we'll see you next week.
Cindy,
This time,
Cindy,
yes.
if I may, just one more
Sure.
thing, as we sort of talked about community sports at the school level. I also want to mention one other large community sport that's going on right now, and that's the Beachfront Park soccer program. And just again, remind everyone that this is a mask mandate. We must wear masks indoors. We must wear masks outside when we cannot socially distance. And like Jeff said, I've received several reports that did not occur this last Saturday. And with the cases that we have with our hospitals being overrun, like Dr. Stutz was talking about, we must do more. We must do more to try to curb what we are seeing. And so that is one of those events that we must take ownership of, and we must wear those masks. We must social distance if we possibly can. And then the other thing is just a reminder about Labor Day. Labor Day is coming up. It's a big holiday. A lot of people like to get together. Again, we've lived with this virus now for over a year and a half. We know these things that we can do. We know these things that we have to do right now for our community to try to get out of this. So those are just my final thoughts heading into this Labor Day weekend.
Thank you, Eric. So did any of the other panelists have anything else that they wanted to add then before we close this meeting? Great, thank you. Thank you all so much. Please stay safe.
Thanks
And
to the
we'll see
chamber
you
for
next week.
hosting this. We appreciate it. Thank you.
Thank you.
Yeah.